An epidural is a more complicated form of pain relief in labour. They're done by specially trained anaesthetic doctors, and it is possible to be completely pain-free with an epidural. An epidural is a fine plastic tube which is placed near the nerves of your spine. During labour, a mixture of weak anaesthetic pain-killing medicine is used to numb out the pain nerves, which are very tiny, while trying not to affect the bigger muscle-pushing nerves too much. But once an epidural is in place and working well, stronger medicines can usually be used if needed for stitches, instrumental delivery, or even caesarean section. You can have an epidural at any point you choose during your labour. Before you do, there are a few things we need to do to make sure it's safe. You will need to be on delivery suite, have a drip sighted, and have a period of monitoring your baby's heartbeat. There are a few rare circumstances that might mean an epidural is not suitable for you, which an anaesthetist will explain if relevant. They will chat to you about risks and benefits and give you a chance to ask any questions you have before starting. To do the epidural, your anaesthetist and midwife will help you get into a good position. They will numb the part of your back where the epidural will go. The epidural catheter is then placed into the right place through a needle, and the needle is then removed so no needles are left in your back. The whole thing is then stuck down with a dressing so it's secure and can be used throughout your labour. The whole process takes about 20 minutes, and then about a further 20 minutes to set it up and get pain relief. Your anaesthetist will be used to trying to time it between your contractions. If you need them to stop and use your gas and air or move while they're doing it, just let them know and they'll make themselves safe until you're ready to start again. The medicine we use for an epidural has little or no effect on your baby and will not make you feel drowsy or sick. Very occasionally it can cause your blood pressure to drop a little, which we can treat. Once your epidural is in, you will be monitored a little more closely to start off with to make sure your blood pressure and your baby's heart rate stays stable and to make sure your pain settles. For more information, please have a look at the labourpains.org website, which will explain and provides a very useful video of the process.